The healthcare system in our country has been regularly termed a crisis. You said that the term crisis is too casually used when describing this. So what would you say to the people them who are probably misinformed or worried about the state of healthcare in Jamaica in regards to?
Well, yeah, I would not say at all that the health system is in a crisis. And I know it's used a lot by the opposition and everything is a crisis. Crisis is a matter of perspective. I mean, I'm sure people experience crisis every day, either because of their personal condition and they go to health to seek remedy. The remedy is not immediate, then they say the system is in a crisis. What we have to do is work more at helping people to understand how the health system works. And where people experience bad treatment, we have to deal with it. I don't shy away from that. I tell people that there's a mechanism for you to report. In fact, what we have done now is put on almost all the waiting area walls a toll-free number where people can call. And it goes to the CEO. And if it needs be, it can come even up to my office. Because we want to hear from people when they experience bad things. I get WhatsApps weekly. And if I get it about Port Antonio Hospital, I send it to the regional director who is in charge of the parish or the CEO, and I tell him I want back a report the day after. Everybody in Jamaica have my number, almost everybody.
Wow.
So my number, all 3 o'clock in the morning, people come.
Oh no.
Right? But I don't mind, not calls, more like WhatsApps, because the calls become annoying. But it's hard for me to see a WhatsApp and not respond to it. So I forward them to the relevant people to deal with it. So it's a work in progress, I agree. I think it has gotten better. But the truth is, I don't think you'll ever get to perfection because health is just constantly evolving. If it's not a dengue outbreak, it's a Zika outbreak, it's a ZikV outbreak, is something else. It just never stops. And after doing it for almost 10 years and getting a lot of gray hairs for it, then, yes. And
you realize not everything is urgent. It's a problem.
It's a matter how you manage it. And the first thing you do in a crisis is to try and bring some calm to the situation. So I've tried to be very more methodical in terms of how I think through things. COVID taught me a lot of that.
Wow.
I remember when we were waiting on oxygen, when we almost ran out, literally within an hour of running out. I remember COVID is a lung disease, so people couldn't breathe. People would have died, a lot of people. I remember the morning about 1 a.m. when the oxygen came into the country, went to the plant and was distributed. And I set up the whole night watching and getting the report, going to hospitals that were on the verge of running out. Now that would have been a crisis, a real crisis. So we come close a lot of times. And again, on a smaller scale, yes, other persons have experienced crisis. We just deal with them and try to overcome them.
Speaking of crisis, I went on social media, I saw a crisis to come back. The Cornwall Regional Hospital, it's renovating now. What's the current status of it? And when is it slated for completion?
Right. So Cornwall Regional was a crisis. There's no doubt about it.
It was falling down.
Yeah. Picture this. You have 450 people in beds, some of them very critically ill. And all of a sudden you're being told that you must shut down the hospital because of air quality issues, toxic fumes coming out of the walls and so on, which, by the way, never happened overnight. 10 years before, and nobody was doing anything about it, which is why I said to the opposition that you're as much at fault as anybody else because you were there while I never did anything. Anyway, it collapsed like any of us would or any car would. If you not tune up the car, it will stop driving on you one day. The problem is that you could come out of the car and go take a bus. You can't take people on life support out of a hospital and put them out on the street because they would die. So we had to do things. We had to find a way to literally build a hospital around the hospital. So for example, let me give you an example. We have a nurses' quarters where nurses live. We had to move out all of them, run the necessary mechanical devices like oxygen tubes and so on, convert them into wards so the patients them can be moved from the hospital into the nurses area. That's where the hospital now is, in the nurses area, the nurses accommodation or previously nurses accommodation. We had to create labs to do lab work. We had to create dialysis center. We had to move people out to Mount Salem Clinic, turn it into A&E, and I could go on and on. So there was a lot of build out that took place. And then we said the problem was a ventilation problem, and said we'd buy a new ventilation system to install. Well, it turns out that once you got in there and started to dig the wall, you realize that every pipe was leaking, every piece of electrical was corroded, the roof because the water was coming from the top, going through the walls and corroding everything. So then we just decided to just bold, strip down the building to nothing. So we took out everything out of the building.
Wow.
And hence why the time delays and why the rescoping of cost.
Yeah, because it says $24 billion and it's 8 years.
So first of all, it sounds bad and it's easy to take a sort of emotionally charged posture and indeed to even politically exploit it. And I'm the politician here, you don't have to say anything, right? But it has been exploited. And it has been exploited because, yes, it appeals to the emotions. But it's a kind of exploitation which I think is reckless. Because health really should be, we have to be more responsible about how we deal with healthcare. The truth is, the services of Cornwall still exist. Last year they treated thousands of people. The building has to go through substantial overhaul, and the rescoping is how we projected to the 24 billion, but we only spent 9 billion already. The people out there talking about 24 billion, them accusing of overspending and calling 24 billion when the money not spent yet. 15 billion not spent yet, you know. It's still down a BOGR by Ministry of Finance. So, and there are enough documentation to show what has been spent, but part of that is building out around, sustaining the services, stripping down the building and rebuilding it. So when it is finished, you're going to have a new hospital. Now, back to your question about when. We've started to phase reopening. The anticipation is that by April, the first quarter of next year. Now, also bear in mind on timing, which a lot of people miss in the narrative, that for 3 years we couldn't do anything because of COVID. So technically speaking, we have really been working on the hospital more like 4 years, 4 plus. For those 3 years when COVID was taking place, nobody could go on this side because of restrictions. And we were building out COVID wards. We built COVID ward at Falmouth, we built at St. Joseph's. We were focusing on that.
So you had to pause.
We had to pause. We had to pause. So even that is a kind of dishonest assessment of the situation by those who know. I don't mean people who are casual about it and don't understand. But those who comment on it know that this is the case. But they choose to take a different perspective. Part of the cut and thrust of the politics, we just have to...
Because that's what I wanted to ask you, because it's not just Cornwall Regional Hospital. There are several hospitals island-wide that really needs improvement, you know, in infrastructure, in services, with personnel. Like it's a lot. So is it unfair for people to expect, you know, your government, your ministry, you as the minister, to overhaul and to kind of do the magic one and make it happen within 5 years?
That's a good point, because what has happened over the years is that there has been a suboptimal expenditure on health. So let me just tell you, as the population grew, kind of taper off now and like to come down if you don't have more babies. Because of population decline.
But that's why we're not supposed to have anymore. Our resources can't manage it.
I want to take it up. I want to take on that question. It's a serious issue now. Replacement population is lower than what it should be. So in another 10 years, we might be 2 million as opposed to 3 million.
Good.
Why is that good?
Less traffic, you know.
Less people, less resources.
So let me tell you, the population grows, the sick profile grows, and the expenditure on health. So what you have is a greater demand on an existing system which was never built for that number. This government is the government that has spent more on health infrastructure than any other. And I make no apologies for it because the facts speak for themselves. The expenditure budget on building out hospitals and health centers is more than any time before since independence. So as a result of that, if you go to Spanish Town now, you see 2 cranes in the air. I've never seen that in Spanish Town in my lifetime, right? Building a 6-story building on Spanish Town Hospital compound, which will have another 129 rooms, 5 new operating theaters, and I could go on. We're going to do the same to Maypen. We built out Chapelton Community Hospital. We're doing the same to St. Anne's Bay. We're building the Western Child and Adolescent, which is partly supported by the Chinese government, partly by us. And of course, Cornwall is a substantial overhaul. So when combined, we're going to be adding as a government nearly 800 new beds to the health system. Many new operating theaters, I think about 29 or 30. More space at the community level. All of this is trying to right-size what we had as a gap over many years. It's hard to do it in the time that we have, which is why we said third term loading.
You guys think you're deserving of the third term, really?
Absolutely. Let me tell you, I have been part of this government, and with all the challenges, and listen, nobody is perfect, and no government is perfect.
Right.
And the truth is, the way our democracy works, it's supposed to have checks and balances to call you out when they think you're not doing something or should be doing something.
Right.
So I'm not here defending perfection. I'm here defending what serves the greater good of the people. And I'm saying to you that from that perspective, this government has done more to create jobs, to stabilize the economy, to build out healthcare, to reduce poverty, to give people more opportunities than any other government that I can think of in my lifetime. In fact, the last time I think there was so much hope about the future in Jamaica is probably the 1960s after independence, when people really were into the national identity and pursuing their own, whatever.
Yeah.
The 70s was a chaotic period, as you know.
Yes, the 80s.
The 80s were extremely
Violence.
challenges for various reasons. And I could go on and on. So, I really hope that the Jamaican people sees it for what it is. Clearly, I'm defending a political organization. I'm sure others have their own perspective. But I am happy to be a part of history now where we have survived a lot and put ourselves on a trajectory to move forward. And I'd like to see that continue.
What about KPH?
Yeah,
because there
KPH.
was a shutdown there as well, and of course there's going to be a new KPH.
Right.
Indeed.
So
So what's the
KPH
timeline on that?
Right. So KPH had a operating theater shutdown because of the ventilation system again, the AC. We have a serious problem with supplier consistency to ensure that these systems work. And operating theaters are very vulnerable because that's where most diseases go to get either cut out and destroyed or cured. So the natural environment there is very sensitive. And if you don't deep clean it and so on, all of those contaminants create a problem. But KPH is a very old institution, 200 and odd years old. And while they've added a lot over time, you have a lot of parts of it that are old. So what we did, we're negotiating now to buy lands in and around KPH. We have established a technical team that has started some technical work to look at how we design a new KPH, ultimately leading to the building of a new KPH, which is well-deserved. It's going to take a few years. So we're doing some internal works to sustain what we have. But we definitely need to, and the government is committed to doing that.
Minister, it seems as if the problem is you guys are building new things and you're creating new wards, theaters, but it really seems the issue is maintaining and servicing, which is always the issue. So why isn't, and it wouldn't necessarily be you, but why isn't more done, especially with the permanent secretaries who don't change based on the government when the government change, and other technical or technocrats in each ministry? Why isn't more care done to maintain and keep the service going? Because Cornwall shouldn't have gotten to the point it should have gotten to. KPH shouldn't have gotten to the point it has gotten to. So why is there a lack of maintenance?
I think it's just the way the system has evolved, unfortunately. We celebrate new things and we don't sufficiently realize the life cycle value of what those new things are to bring to us.
Right.
So you buy a piece of equipment, first time it loses a screw, it gets pushed in a corner. And it really is penny wise and pound foolish. So we have maintenance crews, at all the hospitals. But in comparison to what they need to do and the size of the crew and the technical qualification of the crew, where there is a function of not having the people that you need, the truth is it's far inadequate. So what we do, we outsource some of the maintenance. So the combination is what should work, but to be brutally frank, it does not work. So what we're doing now, we're doing some new service level agreements in terms of the hospitals and the regions that says, for example, if you buy a new piece of diagnostic equipment, a CT scan, you have to buy the extended service warranty with it.
Okay, like the drill.
Right, the drill. Like the drill. Exactly.
Let's go into
I know, did you don't ask me about the drill?
We're
we can shift into it now.
But yeah, exactly. So what happens is that the manufacturer or the manufacturer's rep has a legal obligation to maintain it for a period of time. I find that will work better because if you leave it to anybody else, a workshop or local, it don't get repaired. But we have to take the same approach to the buildings. Every time a pipe leaks, and by the way, it applies to your house, it applies to everywhere. If the pipe start drip, you try and fix that pipe. Because eventually, some dripping will take place somewhere else. You not only have water bill to deal with, it dripping on the wall. Once a wall becomes wet, it leads to all sorts of corrosion, mold and everything. And I don't think we have done that well enough. So in my sectorial 2 days ago, I asked that we appoint a manager for operating theaters at all hospitals, that they have routine scheduling, routine maintenance. In other words, you don't just use the thing till it broke down.
Yeah.
You shut it down for some time and maintain it in a proper way. So we're going to have to do that more, and that has to be accompanying the build out that we're taking place now, because otherwise it won't last.
Yeah, because you're building all these new things, and then is it going to be the same thing 10 years from now again?
That's the problem. That's the point.
Well, you mentioned earlier about COVID being an issue in regards to the pace of progress in regards to these type of transformational things, but some people feel like said them type of transformation should have happened sooner. So what would you say to the people that have been, or at least expressed some frustration about the pace of progress?
Yeah, the pace of progress is always an issue from the perspective of the user who wants better. And you have to understand why. When you campaign in our democracy, you raise expectations. So that's how you get support. You create hope. And people buy into the hope and support you. And they expect you to deliver after the fact. Sometimes the deliverable is easy because it's some decisions you make, like the 1.5, which the government delivered on, and many people were happy for that. We campaigned on it, we won, and we delivered. Other times, if it's about building out infrastructure, it takes time because of the bureaucracy involved. Let me give you an example of the challenge that I face with this build out of hospitals. I went to Washington 6 months after I became Minister of Health. And negotiated or started a discussion with the IDB to borrow money to support the build out of the Spanish towns and so on. We only broke ground like 8 months ago in the second term. In other words, it went through a process that involved multiple layers of meetings, approvals, send back, come back, go there, so cabinet, blah, 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 then procurement. I'll give you another example of how things are frustrating. Even with the 3 years of COVID with Cornwall Regional, I looked at the data. We have about, for the $8 billion spent, there are about 35 contractors that were involved, I'm told. The average period of time it takes to get an approval for a project, for a procurement, for buying something, was between 5 and 8 months.
Wow.
So can you imagine how frustrating it is that you need to move from that phase to get something done? And it have to go through a procurement process that takes 5 months? It's crazy.
Must be.
Crazy.
Must be frustrating to a lot of people. But me have to ask you this as well, because, this new healthcare transformation, it sounds promising, but for everyday Jamaicans, especially for those in the rural communities and areas, what concrete changes can they expect to see?
Okay. One of the things I'm hoping for, and I think some people are already seeing it, one, they can identify with their closest health center that will see better service, a better quality health center, meaning you can go there and sit down in comfort. You can use a bathroom and so on. You can see a doctor. We're putting more doctors in our health centers. Some health centers didn't have doctors or don't have doctors. They only have a nurse, especially the deep rural ones. So we're trying also to make a doctor there 5 days a week, because some health centers have a doctor 2 days a week or 1 day a week. So what we have done is hired more doctors in primary health care. So if you can get better service at that level, and I think people will, and are in some instances, then I think it will keep the thing in the community. Secondly, the NHF, which has more distribution outlets, we have more drugstore pharmacies around the country. I think we're about 150 or something, right? All hospitals have, a number of health centers have, and some are in private pharmacies. The NHF has written 3 million prescriptions last year. We have added 6 more categories of illness. So, for example, cancers.
Cancer, it was just
In
2.
2015, we only had 2. We have 5 now. So more Jamaicans can expect access to either free medication or subsidized medication. And that's a good thing.
Yeah.
So those are two.
I benefit from the NHF. Yeah.
We all do.
They do.
Right? Because even once you have an NHF card, by the way, which you can get in 15 minutes. Once you qualify, you can go to a pharmacy and get subsidy. Those two, to me, are very tangible benefits that will come certainly at the primary level and from a medication standpoint.
So hold on that. So with these new buildings, being built, where you get the doctor them from when all of them are left for going elsewhere?
That's a good question.
The brain drain is an issue.
Yeah.
That's a good question.
Yes.
Very, very good question. Well,
And you say you're not opposed to importing, but then that must be an issue with.
yes. So you know that we have advertised the Barwin Scholarship, which will be published in the paper this week for the second year. Last year, we gave 500 and odd Jamaicans an opportunity to go and study some area of healthcare on the condition that they come back and work in the system for 3 to 5 years. So we have a bonded arrangement for this. This year, we're doing 500 million again. We have special areas that we want to focus on where the scarcity is. So that's a development program. Secondly, we're going to have to improve the retention strategy to get people to want to live here. Building out new facilities is one. Paying people more is another. Giving them housing, especially if they have to work in rural, is a third. And we're doing some of that now. We're going to have to do more of that. And then thirdly, you're right. We're going to have a more liberal approach to others who can come in and work. If we need somebody and we don't have them, and we can get them from Cuba, as we do now, or India, or the Philippines, we can't rule it out, because otherwise the opposite of that is not to have the person, not to have the skill set.
Yeah. So
Is medical tourism a part of the vision?
Yes.
what do you mean by that, though? Medical tourism?
It means offering health services to non-Jamaicans.
Yeah.
People come in for that. People do it now, by the way, but they come from the small islands. They go to UWI, they fly in and they get treated and go back. I love the small islands.
No offense, but
I'm not offended.
why them come here? No, I'm just saying, like,
Why?
they're coming here. Like, most people leave, most Jamaicans leave Jamaica
but
to
you have
get...
to understand what is in a country that has 50,000 people.
Yeah.
Or
Okay.
30,000 people.
Yeah, which is most of
They
us.
would not have some of the services. So they kind of have to. But having said that, we also have some services that are seen as good quality services.
See, me I take Jamaica, I'm
Take
sorry.
it for granted, That's a big diss, by the way, for the health system.
Because he did say small
I'm big diss
islands.
to the minister.
No, I'm just like, many of us,
Okay.
or not even us, me, got Andrews and Yui.
But can I tell you that a lot of people leave Jamaica and go foreign and end up with a Jamaican doctor to treat them?
You see?
That's what I say. You're going to pay less here and get a good Jamaican doctor.
But do you get quality
Absolutely.
healthcare?
I have no hesitancy in saying that Jamaican medical workers, doctors, nurses, and others are some of the best in the world.
True, I must say.
The training is quite rigid, yeah. And a lot of them, that's why they leave,
Yeah.
Because they get good offers and they go abroad and they do extremely well. And we end up eventually going abroad. Some people to get treatment from the same Jamaica.
Yeah.
I'm guessing that along with the infrastructure in
The infrastructure is a big part.
Yeah.
It's a big part.
So and I'm sure it's not just in the health sector, but teachers too leaving, police officer, like there are a lot of professionals and there are a lot of civil servants who are leaving Jamaica to go overseas to improve other people's economy.
Well, look at it this way.
are suffering.
More generally, labor has become the most mobile it has ever been. People can move, go anywhere they want to go now, because every country have liberal policies. And indeed, many of them invite people to come.
Yeah, except USA.
Countries like Canada, if you have a particular qualification, and they invite you to come. We are not so closed either. A lot of people don't recognize it, but it is a fact that we have probably almost every single nationality here working in some space or the other.
Yeah.
We have Spanish investors, we have French investors, we have, all over. The Bauxite Company, Russia, whatever. And you see the expatriate community in Jamaica is quite large.
Yeah.
And a lot come and don't want to go back.
True. I see that
That's
Pika.
quality of life.
Yeah, Pika just said like a number of countries who or not lots of residents from different countries get them Jamaican
Jamaica is a beautiful place,
It is. I just wish it would be better, man.
That's the
Be
thing.
careful of what you don't appreciate.
True.
Because many people go foreign and say they're just dead to come back.
That's true. That's true.
Beautiful, but can be better.
I also have to ask you about nurses, because a lot of them feel underappreciated or under attack. What are you looking to do on a personal level to make them feel more appreciated and, where them feel like they can earn a living here and conditions can be more favorable for them to work in the country where them want to live and
As a son of
burn
a
out,
nurse.
of course. So it's personal.
Well, I want to salute you and salute your mother.
Yes.
Because
who I've been told about several times.
the nurse is probably the most consistent feature of our public health system.
Yeah.
When I visit hospital at 12 o'clock at night or 1 o'clock, and I do sometimes, there's no doctor, there's always a nurse, right? So they run the public health system, and we have a lot of regard for them. We have about 5,500 in the system. We have done a lot in terms of, since this government, the compensation review has in fact increased the compensation package for all categories, and nurses have fared fairly well, I think, and well deserved. We have to do a little more, as I say, on the accommodation side, especially because a lot of them have to work late hours, long hours, in rural parts. As I said, they are the most consistent feature, and so we have to do more around that kind of well-being scenario to make sure that they feel protected. And that's something that we have to work on. There was a tragic incident recently, you saw that, where this nurse was violated in the most atrocious way, which society rightfully decried. So the working conditions is one, which we have to improve on. The recognition for their efforts is another.
Yes.
The compensation, as I've said, we have tried to work on. And really just give them opportunities to keep improving themselves, because job satisfaction is derived not just from pay. People must feel recognized, appreciated in their space.
Someone bring it up,
Yeah, and that's what we need to do more of that. I've tried to do it. I mean, the government has tried to do it. The Nurses Association of Jamaica and myself have a good relationship and have had over the years.
Yeah, because you're usually the most contentious.
Me?
No. The nurses. I'm from a little penny.
Just to protect myself, I wouldn't say they're contentious.
Okay.
I'll just say they're assertive.
I remember watching news, and they're always protesting. What's her name? I think she died recently, but she was the not recently, but she died. But she was the head. But she was the head of the Nurses Association, and she was always agitating for them. They
are an assertive group, and they speak their mind, which is fine. They're a large group, and they recognize the importance of their presence. So that's always a leverage for them. And guess what? Everybody leveraged it from their strength. So we just have to make sure them are all right.